our community. One of our ambassadors, she is graduating, so we're very excited. She's going on to UNC Chapel Hill to pursue a degree either in public health or in environmental health, and we are really voting for public health. So we're really hoping she'll be on these webinars in the future as a professional. So thank you, Jasmine, for helping me today. All right, we are right at 1 o'clock. So I want to be mindful of everyone's time and I'm going to go ahead and get started. Thank you so much for coming to our session today. We are so excited to have you with us, joining us. So I'm going to give you a little bit of background about who I am. I told you a little bit about Jasmine, who's a very key instrumental person in this project as well. But I'm Polly Edwards-Paget. I'm the Adolescent Health Program Director at the Mary Black Foundation. The Mary Black Foundation is a Tier 1B recipient. I'm going to tell you a little bit about the history of how this grant came to a private foundation and how we feel like that has been such a wonderful thing for our community. Our initiative that we started in 2015 was named by our youth and adults in the community called Kynect. And Kynect is about positive youth outcomes for all of our young people. I'm going to scroll here. Hopefully, if this lets me. Here we go. So Kynect is an initiative, it's an adolescent health initiative of the Mary Black Foundation. Our goal really is positive youth outcomes for all adolescents. As I said earlier, obviously we're funded through the Office of Adolescent or Office of Population Affairs, and the contents of these materials are strictly ours at the Mary Black Foundation and do not necessarily reflect the opinions or views of Health and Human Services. So at the Mary Black Foundation, we are a private foundation that has focused in two focus areas: early childhood development and healthy eating, active living. And back in 2008, which you're going to hear and see a little bit of, we took on the teen pregnancy prevention work as part of our early childhood development upstream strategy to really get ahead of kindergarten readiness, fully understanding that if we didn't have ready families, we weren't going to have ready kindergartners. And so teen pregnancy became a part of our work in actually 2008. And we've been able to continue that work through this initiative. What Kynect does and what the initiative is really looking at is we're a collaborative of local youth serving agencies. For those of you who have philanthropy in your own communities, we don't do direct service. That's not what the philanthropic community is about. It really was, how could we convene and bring together our youth serving agencies, help build their capacity in adolescent friendly services, and implement the evidence-based interventions that we know were going to help us reduce teen pregnancy rates. We also really wanted to make sure that we were bringing awareness of adolescent issues and breaking down barriers to address the needs of our youth. We really sought to improve the outcomes for our most valuable resource. We really do believe our future is our young people, and we wanted to make sure we were addressing not just their sexual health needs, but all of those needs, and understanding the co-occurrences that were being impacted by sexual health. But I have to say, all of this work, once again, in the philanthropy world, we are not effective if we're not engaging the communities that we seek to serve and we seek to impact. And so we really brought together a great group of adults in our community advisory board. They spearheaded this entire initiative. There were over 52 community advisory board members from all serving agencies, which we're going to talk about. And then we had our youth ambassador teams. We often say at the Mary Black Foundation, it's not about youth having a seat at the table, is recognizing that they are the table and they will decide who gets to pull up a chair. And we were honored to be a part of that with them. So who are our partners? Once again, we don't do direct service, but our job was to really connect with those organizations that wanted to impact adolescent health outcomes, from healthcare professionals to school-based organizations, faith community, nonprofits, all of our state agencies, law enforcement, employers, advocates, anyone who really wanted to impact adolescent health. It didn't have to specifically be sexual health, but we're working with young people, we're wanting to have an impact on health outcomes. We invited to be a part of the Community Advisory Board. We really work with those partners to build their capacity, ensuring systems to support seamless adolescent-friendly services, supports and opportunities for the youth and young people in our community. I think one of the things we sometimes would talk about, as a task force that's a little different for us is that in our community, we had a lot of youth serving projects and collaboratives going on. We had our Road to Better Health initiative, which is a collective impact project through our United Way. We had the Economic Mobility Initiative, which was through the MDC work that some of you may be familiar with in Spartanburg. We had our Youth Council at the library. We had our School District Consortium, which actually launched and started through the Kynect initiative that had DASH funding, the Division of Adolescent School Health Services with CDC. And then we had our SAMHSA project, which was Impact Spartanburg. All of these initiatives had some sort of state, private, federal funding to really work in adolescent health. And so we wanted to make sure that we brought together all of those entities and putting together a plan, that it wasn't different messages that weren't clear and concise, that we were all working together and mobilizing our community to improve health. And two additional initiatives that came out of Kynect were our Child and Adolescent Behavioral Health Task Force and our Out of School Time Collaborative, which we're going to talk a lot more about here. So really my goal for today is to really talk to you about how all of these partners, all of these organizations came together and said, how can we work together to put together a countywide plan to improve adolescent health? And we really embraced the Think, Act, Grow framework. The Office of Adolescent Health put out the Think, Act, Grow framework. We had reviewed it. We had already started talking about the social determinants of health and how it was impacting teen pregnancy, as well as a lot of the co-occurrence issues that we wanted to look at. And we really felt like this was the framework that worked for our community. And it was one that all of us could rally and get behind. And we knew that it was going to have an impact in our community long term. And so I kind of laughed. My project officer at the time was Cassandra Ches. And Cassandra sent us a big box of Think, Act, Grow materials. And we took them and used them. And we think it has substantially changed our community and has had some of the biggest impacts we've seen with the federal strategy in our community. So the two objectives for today is for you really to understand the community mobilization as a strategy to institutionalize Think, Act, Grow in your community and increase the understanding of what we did and how we've really institutionalized that framework. That's a framework that's going to live in our community beyond the federal funds, and folks have integrated into their primary work. And so to let you know a little bit about what that looks like. Mobilizing the community. I always feel it's such a great honor to represent these amazing human beings you see here on the screen. This is just a small sample of our Community Advisory Board, but so many of them were so engaged in this work over the last 5 years. Mobilizing the community for us was really figuring out who were those key stakeholders, but it wasn't just the key stakeholders. It was also those that were listening and hearing in the field where the barriers were, remembering that CAB existed to break down those barriers. And so we really needed to listen and hear from those that were experiencing them, what were the systems and the barriers they were facing. So our direct service providers, our anchor institutions are critical. Department of Social Services, Department of Juvenile Justice, law enforcement, school systems, FQHCs, Title X, and hospital systems. Were all involved in the Community Advisory Board. And we knew those institutions were really defining the systems that our young people were interfacing with, as well as champions and advocates that were willing to be vocal and stand up for what they knew was best for our young people. So we really started in the needs assessment phase. Obviously, several of you probably have already received federal funds where we, the first phase in the first year is your needs assessment and your data collection piece. We were coming off of the heels of another federal grant. So folks often ask us how we've achieved some of the outcomes that you're going to see at the end of this presentation. And I always like to say that this was not a 5-year journey. This has been a 10-year journey. So we were funded by CDC as one of the communities of greatest need in 2010. That funding came through another organization that was in our capital, Columbia, South Carolina, coming in and helping our community. It was very focused on sexual health, and we had a lot of the good foundation work that we needed done in sexual health happened during that time. And what we found in 2014 as they were beginning to leave our community and doing door-to-door surveys about the impact of their work is that we still had a large number of youth in our priority areas who had apathy towards contraception use. So that grant was very sexual health focused. One of the things they were saying to us is, it doesn't matter if you use birth control or not. If it's your time to get pregnant, it's your time to get pregnant. They knew where to go. They knew all the information about sexual health, but they had apathy towards using that information. So Community Advisory Board really honed in on that data and really started looking at why have our young people lost hope and why do they not see a future outside of the current future that the current existence that they're in, which we'll talk a little bit about. The other that they really did was a lot of listening. So the adults did a lot of listening. Every CAB meeting ended with a question that we needed to hear from people about. And so they would go back and talk to their colleagues and really try to understand more about the question we needed to learn more about. But we also did youth listening. Jasmine's going to talk a little bit about that. It was important for us to hear firsthand from young people. And our listening model was training, just like these adults went back and talked to their peers. We trained our teenagers to go back and talk to their peers with the questions that we had and we wanted to understand more. So, good needs assessment data, and we 5-year trended that data, which was great to really see where the trends were going. But then we also put that data in the context of listening to our community, their insight on that data and the why. Why were those things not getting better? Why were 98% of our teen pregnancies at the beginning of this grant were amongst 17 to 19-year-olds? Why? Why did they have this apathy towards contraception use? What were we missing? We also really worked hard to define a community-wide adolescent health plan to impact systems. Because we're coming off the heels of another federal project, that federal project had been very focused on direct service. We knew as a rural community in the South how hard it was going to be for us to sustain large-scale federal funding. And so we had learned some lessons there. And our Community Advisory Board really wanted to make sure that we were focused on systems impact to ensure sustainability post-federal funding. So we really embraced the whole child model. So one of the things that you heard in the beginning is that our Community Advisory Board did have a lot of other folks who were focused on other outcomes beyond teen pregnancy. And so one of the things we said early on was, we don't just care about a child's sexual health. We care about their mental health, their physical health. We care about the drug and alcohol, the dating violence. And the reality was all those things were co-occurring. If a young person wasn't making good decisions when it came to their drinking and drug use, they were not going to be making good sexual health decisions. If a young person had experienced adverse childhood experiences and toxic stress, they weren't going to be able to make these good decisions. And some of that was around brain development and the impact of trauma. So we knew that what we wanted for our community, and I think one of the things that my Community Advisory Board member says so well, these are our babies. These are my children will grow up here. And this is what we want for all children in our community, is we want them to feel healthy, safe, engaged, supported, and challenged. We want that for all young people. And so how do we make sure that we're coordinating our policies, our processes, our practices? Are our teachers trained in adverse childhood experiences and understanding trauma? Are our community-based organizations speaking that same language? Are our PE teachers who teach the sex ed saying the same thing the school nurse is saying? Are those folks saying the same thing that the doctors are saying? How are we all getting on one page around how we interface with our young people to ensure their health and wellness. So this is a beautiful visual. I'm sure several of you have seen it before. It's used nationally. This is really what inspired us to say, how is our community rallying around to ensure these things are happening in a seamless way? All of these factors in blue are impacting health and wellness, whether it be sexual health, mental health, substance use, etc. So this is where we really embraced the Think, Act, Grow framework. It's where we really started saying, okay, what's out there? What frameworks exist that allow us to think bigger and broader and really looking at the whole child? We understood the impact of social determinants of health and on health. Those social determinants have played a key role in the CDC grant as well. We began to explore those things. And so when the Think, Act, Grow framework was launched, we were really all on board. For several of you, you've probably already seen this. If you haven't, essentially Think, Act, Grow, and I'm going to give you the link at the end of the presentation to where you can access the full framework. It boils down to these 5 things. When you look at the essentials, what do young people need? They need positive connections with supportive people. They need safe, secure places to live, learn, and play. They need access to high-quality, team-friendly healthcare. They need opportunities for teens to engage as learners, leaders, team members, and workers. And they need coordinated adolescent and family-centered services as needed. Our Community Advisory Board took these 5 things and said, how are these happening in our community in 3 major settings: school, community, and medical settings? And are these things happening in our community, and how can we ensure that they are? And I think one of the things that's always a part of our backstory is that Spartanburg did receive the Culture of Health Prize from Robert Wood Johnson several years ago. I think it was back in 2015. And one of the things that really also inspired us with this framework is the full understanding, as we all know, with social determinants of health, that 30% of a person's health is impacted by their personal behavior. We put so much pressure on young people to say, make good decisions, make good decisions, make good decisions. The reality is that 30% of decision-making is personal decision-making, and 70% stems from their social and economic factors, their physical environment, and their clinical care. So we wanted to make sure that we were doing everything we could in that 70% space to improve health and wellness. All right, so our Community Advisory Board really boiled down into these areas. They really wanted to look at these spaces in our community and how we could improve these areas. So first was establishing hope, promoting positive youth development in the out-of-school time space. In 2015, we had no after-school programming for middle through high. So our elementary did have boys and girls clubs, which were doing a great job. But in 2015, we did have one after-school program in one of the middle schools, but it was closing the same year as our grant was starting. So we knew our young people didn't have these positive youth development opportunities in this space. One of the things that one of our school district personnel often said with one of our community-based organizations, they really teamed up and then kept saying, we have to show kids life outside of Spartanburg, South Carolina, especially for our kids that were living in higher levels of poverty. For that apathetic, well, does it really matter? This is my life. And one of the things that we saw in the Spartanburg economic mobility efforts, they did a lot of research and data. And one of the things they found is that for our kids living in the highest levels of poverty in the city of Spartanburg, there was only a 2% chance that they would be able to come out of that poverty. So there really was a loss of hope in certain parts of our community. And we really had to think through, that was bigger than just talking about sex education. That was really trying to figure out this holistic model and how do we build those protective factors and build resiliency in youth. And we really wanted to figure out what that could look like for our community. We also knew that accessing healthcare had been a big focus on the CDC grant and had gotten us some declines. And so we really wanted to figure out, how do we make sure that there are no wrong doors and no missed opportunities in accessing sexual health care? That was huge for our community. We had 2 teen clinics at the time. And we really wanted to figure out how we could expand upon that, which I'm going to show you some data on how that really worked out well for our kids compared to the rest of the state. We also know the huge role that parents play, and we wanted to make sure that it wasn't just talking about a one-time conversation around sex, but it was more connectedness. How do you connect with your child and stay connected to your child so they see you as the trusted source? We're going to support you in whatever conversation that needs to be, but we really want to focus on your connectedness to your young person. And then building countywide systems to support teen pregnancy prevention. Because we come off a large federal grant, we really wanted to think through the systems and how the systems were going to support this work long term. And then last but not least, our youth engagement. The first three, Establishing Hope, No Wrong Doors, and Parent Child, those three had committees that met monthly. And those monthly committees had their own action plans. They were spearheaded by community advisory board members. And then the CAB met quarterly. So CAB would come all together as one big group 4 times a year, and then these subcommittees were presenting out, once they had their plan together, they were presenting out what they were accomplishing. But in all of these, I had one big requirement. You really have to make sure you're meeting the needs of the most vulnerable. So when you're having these conversations, how do you ensure we're shining a light on who is most vulnerable? And how are we ensuring that we're scaling up and really focused on those groups, customized to their needs? For us, 17 to 19-year-olds was a part of that group because 98% of our teen pregnancies were with that age group. And it's not an age group that's easy to serve, and we had not found strategies to engage that group. Systems involved youth, our Department of Juvenile Justice, Department of Social Services, our alternative schools. How did we make sure that they were also a big part of the conversation and customizing to meet their needs? And then what we call our targeted zip code areas. So in our community, we had certain zip codes that had higher rates. And so we applied for our funding based on these zip codes. We want to make sure we're bringing these rates down and very customized to their needs. And so with CAB and these committees, we also said, think specifically and define specific action items for targeted zip code areas. And so like I said, the CAB really focused in 3 settings: school, community, and medical. Folks make fun of me, and sometimes this is a little cheesy, but I always refer to us as a machine, and that we all were gears. And those gears were, if one gear wasn't working and working well, we weren't going to be successful. So we had to ensure that all these gears were working and moving, and that the message was pretty simple. What CAB wanted to achieve in these 3 settings was clear, consistent messaging. We didn't want doctors telling kids something different than schools. We wanted clear, consistent messaging around health and wellness, whether that was sexual health, other areas of health. There was a clear, consistent message. Part of that clear, consistent message was the community having a clear, consistent communication entity, which was Kynect, the Kynect website, the Kynect social media. They needed one hub to house all the information, to send parents and families and these partners so that we could keep the message clear and consistent. There was no confusion over what that message is, based on the Kynect website and social media helping pump those messages out to youth and their families. Seamless care across the course of adolescence. We had been a part of projects that had said, we're only going to focus on 7th graders. And we knew through the data that outcome was short-lived. So we may get 18 months worth of positive outcomes from that, but that wasn't going to get our kids to 19. We really wanted to define a continuum 6th through 12th grade of how could we support them. Their developmental ages are different, their needs are different, and how do we build a continuum of services that are seamlessly working together, building upon messaging throughout the course of their adolescence. Sustainability, we talked about already, really important for us to figure out, how do we make sure this work is happening, whether there's federal funds or not. Focus on the whole child. We did have one of our great partners on this was our Compassionate Schools initiative. And our community really had fully invested in understanding adverse childhood experiences, trauma-informed classrooms, and how that became a real big part of this conversation as well. Striving to meet needs. So thinking about our targeted zip code areas, those areas predominantly were impoverished. They were predominantly in our city, where we knew that a lot of those young people were facing structural racism just in where they lived. We knew that zip code mattered and the longevity of those communities. It was some work that we were doing around health equity and disparities data. And so we didn't want to just come up with a standard curriculum for everyone. The schools in some ways have to do that. Everybody gets the same thing. But in our communities, we really had the opportunity to customize to meet needs. And one of the things that we found early on is we needed culturally relevant curriculum customized for our young people to really be able to process and have conversations around the structural racism, the stressors of racism that they had been facing in their communities, and our community-based organizations being willing to have those conversations and figuring out strategies that were really meeting their needs and not just something we thought was good. And we heard that in listening, which you'll see. And then looking upstream in prevention. So as you can tell, Mary Black Foundation started investing in teen pregnancy in 2008 as an upstream strategy for kindergarten readiness. And so from the beginning, we were like, what's next for us? How do we get upstream in teen pregnancy long-term, which we'll talk about our partnerships with the schools and doing that work. So, you know, I laugh and say, and I know Jasmine's probably laughing, I can't see everyone, but the gears are the machine. But our machine would not have ever turned on if it weren't for the lightning energy of our young people. They were the electricity. They were what made everything start moving. I can remember being in CAB meetings and adult conversations, and I can remember the first time I presented the first listening session, and it was like a lightning bolt went off. Our community was like, this is what our young people are telling us. This is what we need. Let's get it done. And we're not going to let them down. And so they really were, whether it was the adults' passion for our youth being brave and willing to stand up and say, I want my voice heard. This was really where the energy came. So, you know, for the Tier 1Bs, we all had to have community or youth advisory groups, which we had with our youth ambassadors. But we also wanted to make sure that as a project, we were practicing what we preached. That we were providing opportunities for teens to engage as learners, leaders, team members, and workers, which was a part of the 5 essentials. And so our first listening campaign was done early on in our targeted zip code areas. And we trained young people to be, we used the, it's called Health Kynect. It's a model that has been used across the country on training people from the community that you seek to work with to be the listeners, and then reporting back out to the decision makers. And so that's kind of the model we used here. Our young people went out and listened, and then we facilitated discussion with them on what did you hear and what were kind of the key themes. All this information is on our website under publications. I'm going to give you that link at the end. This is just a short snippet. I think the adults had the assumptions that they were going to hear, we want a Starbucks, we want an arcade, we want, and that is not what happened. Our young people basically said they wanted the 5 essentials. That was something that was a really hard pill for our community advisory board to swallow, to really say, we want green spaces. We want facilities that aren't chained up. We want areas to play. We want opportunities to see life outside of Spartanburg. We want healthy foods. We want to be able to get medicine when our family needs it within walking distance. We want to be able to hold an instrument. Those are all the things that were in the 5 essentials. And I think this, between getting the support of the TAG framework from our federal funder and the hearing our kids say, these are basic needs that every young person should have, that really took our community. And I think sometimes in community mobilization, we talk about when the stars align and it really starts happening. This was really a star aligning moment, and where our community advisory board said, we're going to make these things happen for our young people. These are basic things our young people need, and we as a community are responsible in making these things happen, having safe places for work, play, and school. So I'm going to turn it over to Jasmine now, because I've been talking a lot, to talk a little bit about the youth engagement piece.
Yeah, hi. So I'm Jasmine, as Holly's already said, and I'm a Kynect ambassador. I've been an ambassador for a year, but I've been working with Kynect for about 2 years because I actually did Rise, which I'm going to touch on in a second. So it's really empowering and nice to be like a youth voice, because especially since, you know, Kynect wouldn't really work without our voices. It's really important to have that outlet to be heard and have that little space where it's like, oh my God, adults actually care about how I feel and what I think, and, you know, it can actually put things in the right places. I kind of explain it to my friends like, I'm asking you these questions so I can get you what you need, you know? So talking about the website and just like how we reach out, it's a lot of consistent messaging. I want to say is probably the best part of having a website. A lot of, and a social media in general, it's just seeing the same thing over and over again just helps to like put it in your brain, make sure you don't forget about it. We actually just made a TikTok. I run that, I'm on there, you know, it's fun. But yeah, we have a TikTok dance now, you know, being cool with the kids. Rise and listening are all ways for youth to get engaged and be passionate and talk to adults about what they want to see and what they want in their community. Another really good outlet that we have as well is the Adolescent Health Panel. I was on that last year. It's a great way to just talk to a lot of adults at the same time about exactly what needs to happen for you to be happy and be heard. And I think that's the biggest thing about Kynect really, is that, you know, feeling heard and feeling the space to just be yourself is so important, especially as a teenager. And Kynect really helps teens get what they need through us. And I think that's pretty cool. So I feel like I've talked a lot. So back to Polly.
Never enough, Jasmine. I mean, Jasmine's doing this last minute, which I really appreciate. I think anytime there's a youth on these calls, I want to hear more. So hopefully you've got some questions. We do want you to use the chat and put your questions in. Just put them in as they come up. Don't feel like you need to hold on to those. So if you have any questions so far, you put those in. I think that one of the things our community mobilization effort understood early on is we wouldn't be successful without young people completely being engaged. And so we did, I'm going to show you a little video so you can hear firsthand from our youth.
Kynect is giving teens a voice.
Kynect provides leadership.
Kynect gives me the opportunity to meet other people.
Kynect is an online resource for teens and parents.
Kynect is the voice and the opportunity.
Kynect is breaking down barriers for young people.
Kynect provides inspiration for future leaders.
Kynect is what brings us together.
Kynect is redefining how we meet the needs of teens.
Kynect is establishing hope.
Kynect is giving me a voice.
As you can see, this really embodies the 5 essentials. We didn't have, I've been in the field of teen pregnancy prevention for 20 years. I remember the billboards of the sad girls who were pregnant, looking down about being pregnant. This project really was about how do we build protective factors? How do we focus on the strength of young people? And that's really, this video is a great way of embodying, you know, how we were trying to bring out those 5 essentials. I'm going to talk about each committee and a little bit about what they did. In the beginning of their needs assessment and putting their action plans together, they had to come out with a statement. You know, Spartanburg is, what are we doing here? What is our vision for the future? In establishing hope in the out of school time collaborative, they really were looking at how do we ensure our most vulnerable youth have access to high quality youth development programs in safe and trusted environments, meeting their needs for duration and intensity. We had been a part of other projects that were promoting really 4-week, 6-week type programming. And we knew that based on the research, the real outcomes were coming in the long-term PYD models that could demonstrate duration and intensity. And as one of our young people said, don't come in here with something, ask me to build a relationship and trust with you, and then you'd be gone in 2 months. They had had enough of that. And so we really thought through how do we build models that are multi-year. And we wanted to make sure we were moving them through those. So just a little bit about the accomplishments of this group. This group has done some phenomenal things. Once again, we started at 0 in 2015. Right now, we're at 762 youth in the out-of-school time, receiving services in the out-of-school time space, which is about 14% of our free and reduced lunch kids in the targeted zip code areas, with our goal by 2024 to be at 28%. I think I have a lot of success stories on this one. Our City Park and Rec completely changed how they do their work. Nothing is better than hearing your Park and Rec director say, we went from checking out basketballs to investing in the future of our young people. They completely reworked and looked at their models, their programs, their services, and they totally bought into the 5 essentials and created youth development models, multi-year programs to invest in our young people. We piloted with My Brother's Keeper in one of our school districts, Abinaya, which if you're not familiar with, it's a 5th through 8th grade model, really meeting the needs of our young men of color. And they did an amazing job. Next school year, this was in 1 middle school. Next school year will be in all 3 of our middle schools. They were able to prove impacts on academics, and that being test scores, as well as disciplinary referrals. They had a benchmark that once they had a certain level of dosage, they were substantially improving these 2 outcomes. These 2 champions, which are Kim Moultrie and Antoine Tate, they get all the credit on these first 2 bullets. They did all this work. Their leadership, they were community advisory board members, launched the Out of School Time Collaborative because they were getting such great outcomes, and they kept coming to every CAB meeting talking about how transformational this work was for their organization, for their young people. We launched the Out of School Time Collaborative. It's 32 organizations. It's housed at the Spartanburg academic movement. Because we were able to demonstrate not only health outcomes, but academic outcomes, this think tank organization in our community took on this collaborative. They are now funded through America's Promise, where they are defining shared measures of success as a collaborative and really focusing on that high quality programming. We also, because of this work, and really it was new for us in figuring out this positive youth development world and what this could look like and how do we integrate it into teen pregnancy, we launched with one of our local universities, the University of South Carolina Upstate, which is here in Spartanburg, a certificate program. It's a 30-hour certificate called the Fundamentals of Youth Serving Providers. You have to have the certificate to be on the Kynect website. I can't say Kynect is high quality unless I know that you've gone through substantial training in being adolescent friendly. It's also a requirement to be a part of the Out of School Time Collaborative. We launched a Summer Shakedown. Summer Shakedown is summer scholarships for kids to be able to participate in these, the OST collaboratives initiatives. And then we ensured that in all of this work, we never lost teen pregnancy. Then that was a fear of a lot of folks, was with teen pregnancy get drowned out. The reality was it wasn't. It's still integrated into all of the models. It's still a core focus, but understanding that the EBI paired with PYD was going to have even a bigger impact. And I'm going to share with you just a little bit about the OST. Well, maybe. Let me go back.
The Out of School Time Collaborative really began through the Community Advisory Board, through Kynect at the Mary Black Foundation.
Out of school time refers to any time before school, after school, or during the summer hours.
What I love about Spartanburg is that we always start with a question, and then we build on that information and we set forth a strategy that makes sense for our city.
And so several years ago, Kynect led listening sessions to really hear what their perspective is, and they shared how they needed safe places to go to with adults who cared about them in the out of school time space.
The district's role in the OST is to use this platform to accomplish what we strive to do every day, which is meet the needs of the whole child.
Being a part of the OST initiative has allowed Parks and Recreation to leverage resources, to see where there are gaps, to be able to build our foundation, accommodate where there are accommodations needed.
Fight Club here at Burns High School is a unique program. It gives students a safe place to go in a non-threatening environment to be able to improve their overall health.
Fight Club has affected my life by giving me much better habits, a lot of friends to work with, support each other. If I didn't have Fight Club, I would be bored out of my mind at home.
I've learned how to eat healthy and work out and just live a healthier lifestyle in general. Before Fight Club, I was not working out at all, and now I am, and I've lost 80 pounds since my sophomore year.
Everybody wants to belong somewhere. This is an opportunity for them to be somewhere special and somewhere where they're important and their name means something, and they can work hard to grow socially, emotionally, mentally, and physically.
There are several different types of out-of-school time programs. They touch on the character development. They touch on the sports, the recreation.
The opportunity that OST provides is the opportunity to serve the young person. It creates a platform, a level playing field to where community-based organizations and schools come together and create an atmosphere that is conducive for the child.
We're building their identity, we're building their self-confidence, surrounded by caring, trusted adults so that they can thrive.
The Lights On After School event was a pivotal moment for us in general because that's when we released our out-of-school time blueprint. So we have a 100-day plan where we're really focusing on some near-term priorities. We're also looking at how do we provide trauma-informed training for providers to help build quality experiences.
So we are partnering to provide evidence-based training. Our training is a trauma-informed framework that helps us all understand the significance of creating healthy environments for our youth. The trauma, the stressors that have defined these young people, we can't take those away, but we can create a lot more healthier, positive experiences that then start to define who they are.
My hope is that for the young people, that all the things they've told us that they want and need in Spartanburg, and that the OST Collaborative is able to set those things in motion to make that path from where they are to where they're going very clear and very short.
I know that with our partners and the will and the passion that we have seen so far, that we can change the trajectory of a generation of students here in Spartanburg County.
So that's a little bit about our OST, and that's one of the we see as a sustainable project that we're very excited about in our community. We're running short on time. I told Jasmine that we talk fast, but clearly I'm not talking fast enough. So I'm going to run through these. For our clinical access piece, the No Wrong Doors, No Missed Opportunities, that group really wanted to ensure that all teens and young adults are screened universally, no matter where they are in our healthcare systems. And that we're increasing access points to obtain contraception, including birth control, and removing the barriers as defined by Title 10 in best practices, as well as we had an innovative positive contraception education model. We really wanted to make sure that there was no wrong doors in our community. So they did implement universal screening through their electronic medical records with standardized referrals. So we're a rural community in South Carolina, and so we have one hospital system. I know for some of you bigger cities, that's kind of crazy, but we have one universal system for all of our medical providers. And you know, where I sit right now in the northern part of my county takes me 45 minutes to an hour to get there. Having our 2 teen clinics sitting here in the city was great for our kids in the city, but our rural areas really had no care out there, especially around their sexual health. And so we were able to leverage with a private funder out of Columbia who was doing some work with ACOG around ensuring that our rural providers had Medicaid family planning in their primary care, and that they were screening, and if they were not providing the provisions of care, they were doing referrals in a way that was really removing barriers. one of our most innovative strategies on this project was a community health worker model. As I told you before, our 17 to 19-year-olds were really a priority with this group, with this project, because we were not seeing movement with that group. And we used a model of having a community health worker from the community that could work with our older population. Shell Jones is our community health worker, who is amazing, if you ever get to meet Shell. And Shell was working at our detention center with our incarcerated 17 to 19-year-olds. She worked in our targeted zip code areas as well with this group. She served over 1,000 17 to 19-year-olds using the Possibility for Change RAPS model, the Rapid Adolescent Assessment that is done. It's a computer-based model that then allows her to do motivational interviewing based on their stages of behavior change. Just very innovative work. Because we're short on time, I'm not going to show Shell's video, but it was a really innovative project that we really found how to reach that group. They're in school, they're working, they don't have 9 months to give us. They really were more focused on these short, quicker encounters, which Shell was able to do. Just within our school and community-based programs, over 2,000 youth were referred to clinical care. That was one of the things that was a part of this model, is that whether you are in school, community, or medical, that clear, consistent language also included clear, consistent language around minors' rights, contraception education, and how to access care in our community. And then our young people have done an amazing job around the norms in accessing sexual health care with some of the work that Jasmine mentioned earlier. So data to support these efforts. As I said earlier, the School District Consortium is implementing YRBS in our local community. So we have access to Spartanburg YRBS. In 2019, South Carolina versus Spartanburg, our female students using long-acting reversible contraception was much higher, as well as birth control in general. And we do feel like this coordinated system amongst our medical providers has made that work happen. In the parent-child connectedness area, for this one, it was pretty simple. We as a community embraced the Triple P model, which is a national evidence-based positive parenting program. And so our community advisory board said our model should look no different from birth through adolescence. When we first started, there was like a list of 25 different parenting programs that had been in and out of our community, and no one really knew where they were or what the status was. A lot of them were funder driven, and so they lost their funding and they moved out. And we said, this is ridiculous. When you bring your newborn baby home, if you trust Triple P as your model, that should continue through the course of your child growing up in our community through adolescence. So we did embrace countywide Triple P and included Teen Triple P as part of that. And then all of our anchor institutions that we mentioned earlier are trained as providers in Teen Triple P. So that has been a really wonderful outcome of something that we could easily do that will be institutionalized here in our community. This is where a lot of the effort has been spent, and a lot of community conversations have happened around. When we started looking at our countywide system to support teen pregnancy prevention efforts, we wanted to ensure that kids were always getting high quality, medically accurate sex ed, 6th through 12th grade, period. And so we embraced New Culture and Love Notes. So New Culture is 6th, 7th, and 8th. Love Notes is 9th. They are getting the evidence-based interventions. There's a state law in South Carolina that we were able to use as a leverage point. State DOE was putting out standards and indicators at that time that we could align the curriculum with. I can say that over 13,000, right now we're at about 13,500 and some change, are getting high quality New Culture and Love Notes that we are evaluating. I've got 2 districts we don't evaluate because they're not a part of some of the projects. We know we're using them, but we don't know to what extent quality looks like. But for these over 13,000, we know it's of high quality. Aaron's Law was passed in our state during this federal project, which if you're familiar with Aaron's Law, it's a sexual abuse law that looks at how are you teaching sexual abuse prevention education pre-K through 12th grade. And so that was really a leverage point for us in systems thinking as well. Children who are sexually abused have higher rates of teen pregnancy. For girls, it's 3 times higher. For boys, it's 4 times higher in becoming a teen parent. Also in South Carolina, we have a very high domestic violence rate. And Spartanburg County is in the top 5 counties for the state of South Carolina for women murdered by the hands of their partner. It's something that us as a community have struggled with for the last decade. Something we really have been working hard with the solicitor's office around different strategies, but this gave us the opportunity with Aaron's Law to say, let's teach the context of sex ed in the context of relationships. And if kids can learn before their first partner what a healthy relationship looks like, can we get ahead of the domestic violence issue? So it really was a leverage point for our community. And something that we embraced, the sexual abuse prevention work, as well as the dating violence prevention work. Aaron's Law gave us that opportunity. Our pregnant and parenting teams, they've been a part of the CYSP project. They were very engaged in continuing those efforts was important to our community. We also knew that we weren't getting ahead of the mental health issues that our youth were facing. And there was a lot of disjointedness. I think one of the things that CAB said quite frequently is we have to break down the silos to have these conversations collectively about health. And we knew that we were not doing that in the mental health space. And so we did a quite extensive needs assessment of our young people. And then now we have an active task force addressing those recommendations, as well as all of our public health initiatives in the community working together. So you can see some of the outcomes there towards the bottom around things that we've been able to institutionalize. So I would just say, you know, really as we're starting to wrap up and looking at what happened with our data long-term, when you're talking about community mobilization, whether you choose to use the TAG framework or not, these are what I always say are the key principles. Understanding the need, listening, and acting. Don't listen if you can't act. That was one of our lessons learned on one of our listening campaigns. Engage champions and partners with a shared vision and interest in adolescent health. So it may not be that they're interested in teen pregnancy and their passion is substance use. That's okay. You still can engage them because those co-occurrences, they're win-wins if you're addressing the protective factors for both. Willingness to address the co-occurrences and collaborate on common ground. You know, when I first started looking at EBIs in the school, I didn't necessarily first look at New Culture and Love Notes. They weren't necessarily my favorites, but sitting beside Rape Crisis Safe Homes, the Children's Advocacy Center, looking at how do we make this easy for school districts with Aaron's Law, the Comprehensive Health Act, these merged to the top because of their ability to address the relationship issues. And we wanted to get ahead. These were upstream strategies for these other two groups. And so in the end, it was going to impact teen pregnancy. And we had to have a willingness and an openness to have those dialogues and to read the research, dig through the research to see, does this connect to my issue? Systems thinking, exploring the barriers to success, being willing to ask those questions. It was hard for a community who had been addressing teen pregnancy for 5 years prior for me to walk into the room and say, why haven't you been successful in these areas? When they all had been working in that area for so long. And so they had to be willing to explore the barriers and have the conversations about their systems, especially the systems where they knew that children were facing barriers that were outside of their control of whether or not they could overcome those barriers. Identifying leverage points, reaching out to other funders, other projects, when state laws are getting passed. You know where your leverage points are, where they exist, and stay on top of. I have a little state coalition meeting I go to. Sometimes they talk about things that are not related to my project, but they're always talking about policy. And so I was always getting ahead of what's coming down from the state level that we can use as a leverage point. And then thinking about sustainability. You know, once the funds are gone, is this something we can continue to do? And then last but not least, remembering that all voices are valued. I think young people sold the trust issue when we said, hey, this is yours. You go out, you promote it. It built trust with young people. With adults, the same thing. Everybody was invited to CAB. I don't care if you're CEO, I don't care if you're the executive director, I don't care if you're part-time contractual working with kids, or just a volunteer. Everyone came to the table, and we got everyone on the same page. So this is what our outcomes look like today. I've only got just a few minutes left. So you can see in 2008 when we started, this is when 2008 was funded by our private funders in town to really start looking at teen pregnancy. 2010 is when we received the CDC grant, which was for the 13 communities of greatest need. In 2015 is when we received obviously our Tier 1B. And you can see where we had a faster decline, a greater decline than the state and the nation. And for the first time, dropping below the state rate was quite a party in Spartanburg. So, so in 2008, Spartanburg County had one of the 20 highest birth rates in the state. These are our counties broken out here. By 18, we're in the 12th lowest. This is where we're the most proud. This data is really where we really feel like we concentrated the majority of our funding and our efforts in our targeted zip code areas, as you'll remember from that prior slide. And so in 2001 and in 2018, two of our targeted zip codes, 29301, 29303, fell below the state and county rate for African-American teen births. So our CDC grant was very focused on African-American teens in these zip codes as well. As you can see, their rate was at 122 per 1,000. We've been able to reduce that to 20. The actuals of that is about 48 girls per year becoming pregnant, being reduced to 8 girls per year. We had huge disparity gaps in this data when they started the work in 2008. And then 29303, again, brought that number down substantially, and it now is the lowest rate for all races for the county. So they've eliminated that disparity gap. One of our zip codes, 29306, is still a priority. We had not made the progress as we have in these two others. And so it continues to be on our radar. So I mentioned several videos to y'all earlier. Be sure to check those out. We do have a Kynect Spartanburg YouTube channel. As far as our community response to sustainability, these are some things that our community have said. We really feel like CAB is what has made this happen. Our community advisory board, using the Think, Act, Grow framework, has really increased motivation around these efforts. They want to keep convening. They see the huge value of having this community conversation around adolescent health and it not being siloed. And they really feel like it's what's having the impact in the community. And so we're working to sustain the efforts. So as you can see, I do have a website listed out here with our publications. So please check out more publications and information about some of the things we talked about. I did include the work that we used in the violence prevention piece for sexual abuse and dating violence. Adverse childhood experiences is the first website with cdc.gov. It's a great resource for communities on preventing violence. And then the TAG framework is at the youth.gov website. And I strongly encourage you to read that. And I've only got just a few minutes left, but I'm hoping Jasmine might have some questions that you guys have asked in the chat box.
Actually, we don't have any questions right now.
What? No questions?
Yeah, I know.
Feel free to unmute your lines if you'd like to ask some questions.
Hi there. I have a quick question for you. Thank you all so much for your presentation. What are some other things that you all do in terms of sustainability?
You know, we at the Mary Black Foundation grant write for a lot of our groups. So right now we have about, so if you look at who we fund, the foundation was funding a lot of the evidence-based work. So the school systems were serving the mass. We helped them secure a CDC DASH grant. The Out of School Time Collaborative launched. We helped them secure America's Promise grant. We also have gone after Spartanburg Regional Healthcare. The hospital system is going after federal funding. The City Park and Rec have gone after their own funding as well. I think one of the things that's great about a philanthropy group leading some of these efforts is because we are funders, we're always thinking about sustainability. And so we really work with the partners to keep an eye out for grants that we think they'd be eligible for. Because I'm tracking all of the data, we're researching their work, we partner with them in writing their grants to make sure that they've got the data that they need, all the needs data we talked about in the beginning, we write all that up for them. And so, we're a small rural community in the South, so we really work together as much as possible. We as a community said, yes, we love this adolescent health model and this plan, and we're gonna help keep it going. So the school work, the EBBs in the school are taught by PE teachers. The sexual abuse prevention work and dating violence work is taught by guidance counselors. That is all sustainable. So they've had the only thing we have to do for them annually is training, and the Mary Black Foundation is committed to continuing all the training efforts for them. So I think that when we talk about sustainability, some is what can we buy on the front end, and how do we think about this model? You've been doing this work a long time, and so sometimes people will send people in to do the work. Well, when that grant goes away, they don't have anybody to teach it. And so we really wanted people who were already in building, teaching the EBBs and making sure that they had the capacity they need to do it well. Because it's a lot cheaper to just pay for training and capacity building than to pay for people to do direct service. So I'd say grant writing is one. Two was thinking through the model in a way that if there were no federal funds, what would this look like and how would it work on the front end? And then using the federal resources to get them all the resources they need to be able to keep doing that work. Some people may laugh. Developers were always my biggest barrier because I didn't want to buy and invest in EBBs that had ongoing costs for my community. So I would try to negotiate on the front end while I had federal resources so they wouldn't have ongoing annual subscription fees or cost. Or I'd only work with, I'd think through developers and say, all right, I can't afford to pay you $50,000 a year, right? And this federal fund's gonna be gone. So you're automatically scratched off the list. So who can I work with in keeping the costs low that districts could afford? So those are a few of our sustainability strategies. And then just like for City Park and Rec, I was with them at City Council last month, and the mayor said, you've been doing all this work and receiving federal funds. What do we need to prepare for in our budget? And she said, we've redefined our programs. Our budget won't change that much because we're just doing things in a different way. So it wasn't about adding new, it was looking at the strategies differently.
Okay, thank you so much.
Anybody else? Any questions? Jasmine, any questions in the chat box?
No.
All right. It is 2:01. I had told Jasmine that we would let you guys vote on watching another video, but we have run out of time. But I'll have to say, check out the Rise video on the Kynect YouTube. Jasmine was a rock star in that initiative. So we'd love for you to see that, as well as community health worker, my brother's keeper, City Park and Rec. They all have their own videos showing the amazing work that they're doing, which I could never fit into 1 hour. And so please be sure to check them out. If you have questions or ever need to contact Jasmine or I, you can reach us on Instagram or Facebook. Thank y'all so much for participating today and for listening.
Thank you guys.